Patty Cooper, Division Head of Health Sciences. Within our division, we have 7 different programs. We have the Associate Degree Nursing Program, we have Dental Hygiene Technology, Medical Assisting Technology, Medical Laboratory Technology, Practical Nursing, Radiologic Technology, and Respiratory Care Technology. And here are just a few of the reasons why you should come to Northeast.
And it's an associate's program that will teach us to be RNs, and we are doing clinical experience, but we also get to go into the hospital and work with patients on skills that we have learned here in the classroom. Well, coming into nursing school, before you actually get accepted, you probably need to go ahead and take your AMP1 and your AMP2. Pay very close attention to those 2 classes, because really and truthfully that's your basis on nursing school. To be eligible to be into the program, you have to have at least a 17 or higher, and to have at least a 2.5 GPA. Friends that we've made throughout the program, I really believe will last a lifetime, because I really don't consider them just my friends, they're my family. Because I mean, they understand what I'm going through, and they support me when I'm happy, they support me when I'm sad, and they even give me a hug when I need a shoulder to cry on. So those friends that I make are going to be a great network to have. I mean, we can communicate with each other even when it comes to finding a job or working with those people. Well, the staff at Northeast is absolutely amazing. They're very supportive of what we do. They're great teachers, and they are able to explain it in ways that you can understand. I've always found that if I need to go talk to an instructor or something, they always have an open door policy where we can come in and talk about our concerns, or, you know, the things that aren't so great and the things that are great. I chose Northeast because I actually live in the district, but the main reason I chose Northeast is because I've always heard that Northeast had one of the best nursing programs in the area, and you would have even better chances at jobs because they know the ratings of Northeast and how great it is.
The dental hygiene program is a great program. The instructors are wonderful. You come up, it's most of the time your second year if you get accepted. It's very competitive. There are 11 prerequisites, including your English, your math, science. Of course, science is probably the most important. Speech, a couple of electives. And if you do well in those electives and your prerequisites, and you do very good on your ACT, you are eligible to get accepted into the program, which the program consists of 4 semesters, 2 complete years. So once you're in, you start doing the basics like dental anatomy. You do lab. You get to learn all your instruments. You get to learn how to use them correctly, and you get to learn how to deal with patients. That's really important because you have to have a personality for this field, because once you get in here, you deal with people every day. You see different people every day. Sometimes, you know, you get patients in here, they are recall patients, which means they come every 3 months or every 6 months. It's very important because you spend 2 years of your life with the same people every day. And I know the girls that are in my class have all become some of my very close friends, and I'm really close to all of the instructors. I can go to them about anything. It's just really comfortable, and it helps once you get out.
Okay, you have an option of doing a 11-month certificate program, and then you can go on it and take additional classes to get your associate's degree.
To me, it's a way to get out there and meet people and make a mark on the world.
We work primarily in doctors' offices. We help the provider treat and examine patients. Our administrative skills include patient information, handling insurance processing, and we work as a receptionist. Our clinical skills obtain vital signs, take medical histories, administer injections, and assist with minor surgeries.
Well, obviously I'm from Corinth, Mississippi, so it's real close. It's only a 30-minute drive. I've had a lot of fellow students to come through the program, and they were really satisfied in their education, and I was really impressed, so I thought I might try it. Well, in the medical assistant program, there's only 12 students, so it's more of an intimate setting, So we are able to study together and we talk together and we have more discussions, which kind of bring us closer as a group. Not only do they, we're in an intimate setting in the classroom, we also graduate together, we look for jobs together, and we become more closer as a family instead of just students. They prepare us with the exceptional knowledge that we can go out and have the competency to get a really wonderful job. And
we learn all about parasites and parasitology. We learn about hematology, immunology. We learn go in depth in chemistry and microbiology. We do blood banking, and we also do urine analysis. We go a full 2 years, and we also go a summer, so that would be a full spring, 2 full spring and fall semesters, and added on summer. I came because when I came for my tour, I just love the campus. It's very beautiful, and I love the atmosphere. It's a very small town feeling, and you can walk around campus and you can just see familiar faces, and I love that about Northeast, and I love how I have made so many close friendships, and I love Northeast. The first day I walked in, everybody was just so welcoming, and we were all so excited, and we clicked immediately. I mean, we kind of have to. We're going to be together for the next 2 years and maybe possibly even work with each other for a really long time. We're not just students together. We'll eventually be co-workers together. My instructors, they are very welcoming. They want to do anything to help you. They're very knowledgeable about what they do, and you can tell they love what they do. They come into class almost every day with a smile on their face, and that's encouraging to come into a classroom like that. And they're not just our teachers, instructors. They're there for us no matter what. They tell us their office is always open, and we can come in whenever we need to about anything.
Perk Motion program is a 12-month technical program that teaches us how to insert IVs, urinary catheters. It teaches us how to work under the direction of a registered nurse and physician. When I was in high school, there was a possibility that I wouldn't receive any kind of scholarship or aid, and during our last awards ceremony in my senior year, I actually got an institutional scholarship from Northeast, which changed my mind about going to college. And once I attended, I really enjoyed it. The instructors were excellent. They done everything they could to help you, and they strive to make you want to do better. It's actually really close to home, which is good, because I have 4 small children at home, so that helps. The struggle that you go through as classmates sort of brings you together. The camaraderie that you develop, you share the same experiences. You go to the clinicals together, you study together, eat together. You sort of lift one another up and carry each other through. Once you get accepted as a 12-month program, the prerequisites are you have to have A&P 1 and 2 with at least a C. You have to have at least a 17 on your ACT and a grade point average of 2.0 or higher. You get 100% support from the faculty and staff here. You really can't ask for any better instructors. They're more than just an instructor. They're a friend, and some of them even make you feel like family.
We go to different clinics around, and we do x-rays at hospitals, clinics, orthopedics. We take pictures and make sure that they're good enough for the radiologist to read. What I have learned in this program is that, first of all, patient care. You have to have patient care as top priority. Treat everybody like how you would treat if they were your own family members. We also learned about radiation protection. We learned how to shield our patients, protect them from the radiation that they might get, and how we can protect ourselves on the job. How the equipment works. We go straight into detail, how the circuit works, how the body works, and all the functions, so that we know that when we work exactly how an image is supposed to look. I came to Northeast because they have a high medical programs, and also it's really close to home. The friends I made in the Northeast program was that they're like family. You cry together, you study together, you laugh together, you stress together. Whatever you do it as one. Your friends are in your class are going to be the people that you actually work with. It makes me feel happy that the people I spend 2 years with in the program are going to be my coworkers in the future, because they've seen me at my worst and they see me at my better. My teachers are wonderful teachers. They are always there to have our backs. They help explain everything in detail because they know this is the first time you've learned these things. And whenever you need a question, they're always there to help you. No matter what time of the day, you can always find them and they can always help.
Respiratory technology is all about making sure that the patient has this right amount of oxygen. We deal in emergency situations where sometimes you have to insert tubes to help people to breathe. Sometimes you just give them a little bit of oxygen that they need. It's not always emergency situations. A lot of times you deal with COPD and emphysema patients, long-term patients that you have to take care of to make sure that they can breathe when their lungs aren't functioning properly. A lot of the prereqs for the different health programs are going to be the same. You've got your A&P 1 and 2. You have to take math. Of course, you've got your English and your electives that you have to do also. I chose Northeast Community College because it was convenient. It was close to home. They have lots of different locations that you can see them. They've got New Albany and Boonville and Corinth, so no matter where I was located at the time, it was very easy access to get to. The faculty and the staff is really easy to access. Everybody's definitely there for you. The teachers are very easy to get a hold of through email or text message or phone calls. The people that I'm in the program with, we take very small people into the program, so you're a pretty tight-knit group. It's real easy to make friends and find people to study with, and it's kind of your family away from home for the next 2 years. The great thing about the family that we have here, the friends that we've made, is we're all going to graduate at the same time. We're all looking for jobs at the same time, and hopefully can all get jobs at the same places. It makes it a whole lot easier in a new work field when you're with people that you already know, you're already accustomed to, and you all learn the same things.